Okay, we'll go ahead and get started. Thank you all for getting on this webinar. We are well aware that we are in extraordinary and unprecedented times, and we don't have a playbook. None of us have a playbook for this, and we are here for each other as a resource. So you're going to be hearing from some experts today, but I think something we really have to emphasize is that we have to rely on each other during these times, and you're going to hear about some ways that you guys can do that. And we are trying as PAA to be a resource for you as well. I also want to say and emphasize that as we are taking care of our properties and our residents, it's really important that we take care of ourselves too, because this is a stressful time. So thank you for being on this call. We are open to suggestions and ideas for how we can help all of us manage through this crisis. And we are here for you. So I'm going to turn it over to Amy, who is going to be moderating and facilitating this webinar today. Thank you.
Thank you, Marlene. So I hope we're all in the right place. This is the PAA coronavirus in your apartment community. We're going to talk today with some of our panelists about what's happening out there. As most of you know, there was a poll on the screen. I heard some of you did not get it, but we're going to pull up the results to the poll here just so we can kick off the webinar. So Erica, if you could pull up those results, that'd be great. Or not. The poll question asked if coronavirus had raised your blood pressure at all at any of your businesses or communities. And so I'm pretty sure that our answer is going to be it absolutely did. So that's kind of why this discussion started with PAA. So Erica, if you want to hit the next slide, we'll go right into the webinar. Okay, so this webinar is being recorded for all of us. We will post this webinar to our website for your review. So if there's anything you miss or want to review something, again, you will have the ability to do that. All of our attendees are being muted, but we did notice that some people called in as panelists. So just continue to keep your phone or computer on that mute button. For today's questions, we're asking that everyone uses the Q&A feature at the bottom of your screen. If you have a question, put it into that section of this webinar, and we will be compiling lists of the questions and categorize them for the panelists. And we'll do the questions at the end of the call after our presenters have talked for about 15 to 10 minutes about the subject at hand. Today's panelists are Jill Asch with Hillmann Consulting. She is a corporate health and safety officer. Joining us, we also have Caitlin Bauman. She's with RestoreCore and is managing director. Paul Cohen is here with Cohen Marraccini Law Offices. He's an attorney. Andy Goldberg is president of RestoreCore. I will be your facilitator, Amy Pontius with PAA, VP of Membership Services and Marketing. And we do have Alan Thompson here, CEO of Results Repeat. Next slide, Erica. We do have a disclaimer about the webinar today. The coronavirus crisis is a dynamic situation, and we do recognize that. Alerts and details are changing rapidly. These times are uncharted for us. We've never dealt with this before, and policies, procedures, they're being written right now as we're on this call. What today's webinar will go over is our best guidance for the knowledge as of today as we know it. Your companies and your properties will need to make your best decision based on your needs. We're not giving legal advice today from PAA or from any of our panelists. And it's very important that you check with your own companies to determine the best practices and strategies for your business. Next slide, please. So here at PAA, as we continue to monitor things going on in the state of Pennsylvania, we thought it was very important that the Pennsylvania Apartment Association start the Coronavirus Emergency Assistance Fund, the CEAF as we'll refer to it. This was created to help people who are affected by coronavirus in the rental communities that we're managing. We're currently taking donations for the fund through our website. This workshop today, of course, is free, but if you want to consider making a donation, if you are able, we greatly appreciate that. You can visit our website at pahq.com. It is on our landing page there. We also have underneath membership services, coronavirus updates, and the Coronavirus Emergency Assistance Fund donation page as well. Next slide. So there's lots of facts out there that are coming out from the media. We're not going to touch on those today. That's not the purpose of this call. Today, we're going to look at the state of Pennsylvania. So right now, there's 90 confirmed cases of coronavirus here in Pennsylvania. It's expected that these spikes in the actual virus will continue to rise. For the latest information, you always want to go to the Pennsylvania Department of Health. We've included that website there for you on this page. We were at PAA supposed to have a panelist from the health department with us today. We got this panelist prior to Montgomery County being announced as the largest affected area in the state. So unfortunately, they were unable to dedicate someone solely to our call. So we do apologize for that, but we're going to continue going on with our panel of experts as well today. Next slide. The governor declared non-essential businesses to be shut down for our business here in Pennsylvania. The number one question we've gotten here at PAA is the multifamily housing industry an essential business? And it is. However, individual owners and managers should decide which positions are considered essential. So you would have to take that up with your management company or your owner to determine that. You always want to check your local county for any specific guidance or any regulations. We have a ton of resources on the PA website. You go to pahq.com. Again, if you go to membership services, in that drop-down menu will be the coronavirus updates for you. Next slide, please. Okay, so there is a difference between isolation and being quarantined. Both have two definitions, but the major thing when you look at the definitions, they both agree in one area, and that area is that both definitions are voluntary, but in a public health emergency, such as we may be in, officials have the authority to isolate or quarantine people who are sick or have been exposed. So there's lots of details there. It would be good to review the differences between those, but we wanted to bring them up in our call today. Next slide, please. All right, we're going to have another poll, hopefully. Erica, if you could bring that up for us. Perfect. So the second poll is residents, coronavirus, and quarantine versus isolation. So it's asking you, have any of your residents reported this? And do you have any residents or staff under quarantine or isolation? So if you could take a second to answer that, and we're going to review the results of that.
And Amy, while they're putting their results in, just want to also mention that if anybody has any resources that they would like to share with all of us, you can send them in. I believe it's info@pahq.com. And we would love to have those, and we will post them on our resource page. Again, we're each other's best resource at this time. So if you have found great information on how to manage your properties and your businesses through this crisis, we will be happy to share them with each other.
Thank you, Marlon. Okay, Erica, how are our results coming?
We're currently at 121 answered and 233 people are on the call.
Okay.
Well, let's go ahead and publish them.
Okay, so as you can see, we have a lot of residents that haven't reported either. And then we have more people saying that the residents or staff are not under quarantine or isolation. So that's great. It's a great talking point for us to roll right into our discussion. I want to go ahead and open up the floor to Jill Asch. She's going to kick off our webinar. Jill will have about 10 to 15 minutes to present her information. And Jill, I will go ahead and give you a 2-minute, not a warning, but a 2-minute notice as to wrap things up. So Jill, over to you.
Hello, good morning. Do you hear me?
We can hear
Yes.
you. Go ahead, Jill.
Okay, yes. I'm trying to share my screen, but I can't because you're sharing it right now. Okay. Okay, there we go. I think we should be all set. You'll hopefully all see my screen. So what I am actually talking about, thank you for explaining COVID. I think at this point, we probably know more about COVID than any other diseases that's going on. What I'm going to be talking about is responding in case you do find out that one of your either staff or the residents do have either a confirmed or suspected COVID-19 case. Okay, so what we're going to be looking at, whether the person has a confirmed case or what the Department of Health is calling someone that's a person under investigation, a PUI. That is somebody that that maybe they've had contact with somebody that's confirmed, or they're pretty sure that they might have it. I mean, if you've noticed, a lot of times they talked about people that go to conferences, but they'll have contact with the person that had it. We're not concerned. But if you're a close friend, a relative, or have close contact, you're considered a PUI. So what we've been doing, and my company's been doing it right as we speak. We've done a couple, and we're preparing to do some more. What we're doing is the proper procedure is to get a protocol to do the cleaning from an industrial hygienist. Industrial hygienist, for those that don't know, it's someone that's been trained to protect workers in the workplace, and we've kind of expanded it to the buildings and so forth. I am a certified industrial hygienist. I am also a certified safety professional, and I have my master's in public health. So this is probably the first time that I've actually mentioned public health, because in this case it is a public health thing. Our company has worked at putting together the protocol. So once the protocol is put together, then the protocol is given to the contractor, who must follow the protocol. And the protocol is from the best knowledge of what's going on. And the protocol has changed as CDC or WHO, the World Health Organization, has come by with better information on how to treat or disinfect the areas. So what the industrial hygienist that's overseeing it is making sure that the remediation contractor has all the necessary training. You need a remediation contractor that has the required training. You can't just have your regular cleaning people do it, because they haven't had training in how to do the special cleanup. Okay. Also, making sure that all the workers wear their necessary personal protective equipment. This is number one obviously to protect themselves, but it's also to protect anyone else in the area. You want to make sure that they don't bring anything in. So if I go in with my regular clothes, I clean everything, I walk out with my clothes, now I'm contaminating areas that possibly will contaminate areas that wasn't, that were cleaned first. Also, the protocol ensures proper disinfection. You want to make sure that everything is cleaned appropriately. It's more than just what your regular cleaning staff may be doing. You want to make sure it's cleaned appropriately with the right chemicals, the right methods. And then the most important thing, the proper decontamination methods. You want to make sure that once the cleaning is done, that there's no way of contaminating outside the area. And we're going to talk about that in a little bit. Okay, so what is really required for the responders, and this is why you need a remediation company. They need to have taken certain training. One is the hazard communication training, so they're aware of how to use chemicals, the dangers of chemicals. Some of these chemicals, obviously to get rid of the virus, do have their own hazards. So they need to understand the hazards and need to understand how to read a safety data sheet. They need to have completed a personal protective equipment training, know how to wear this equipment appropriately. It's highly suggested that they've taken bloodborne pathogen training. Now, at this point, we're not considering, well, I guess we are. COVID is considered a bloodborne pathogen. It might be in your blood. You want to make sure that you assume that things are contaminated. Okay. A lot of times when people go in to do the cleaning, it's because, unless they have a confirmed case, it's because someone has close contact with someone who confirms the space. So the space actually may or may not be contaminated. The bloodborne pathogen training gives you the assumption that it is, and that's the way we have to assume. Also, for the employees' protection, they need to have a medical within 1 year. That's the workers. Respiratory training completed within 1 year, and the respiratory fit testing completed within 1 year. That is a OSHA regulation. You are not allowed to wear respiratory protection as part of your job without the appropriate medical and training. If you decide, and you're not doing it as part of your job, to voluntarily wear a respirator, then you don't need all that training. But since the mediation contractor and anyone that's overseeing it is doing it as part of their job, they must have it. Okay, so what the basic building preparation is done is the areas of concern must be vacated and cordoned off. We do highly suggest, both to save time and to save you money, if you can find out where exactly possibly the person of interest possibly went. If you have a 8th-floor building and the person only was on the 4th floor and then the lobby and maybe the cafeteria, you don't need to clean the entire building, just any place where he or she was in. So if it's on the 4th floor, you don't have to worry about the 5th floor or the 3rd floor, okay? But you do want to make sure the ventilation sources are closed off, if possible, or separate from other areas. And that's the remediation contractor can make sure that's going on there. The other thing is anyone in this area concerned must wear appropriate personal protective equipment, or PPE. So not just the remediation company that's in the area of concern or the industrial hygienist doing the oversight, but anybody else. So if your company requires that you have a security guard or a manager overseeing it, he or she also must wear the appropriate personal protective equipment. Okay, and the personal protective equipment, which is suggested, a minimum of safety glasses for any personnel in the area. Anyone that's doing cleaning is suggested to wear goggles or face shields if necessary, okay, depending on the cleaning. Nitrile gloves or whatever gloves are required based on what the safety data sheet states. And that's why your employees, the employees that do the remediation, must have information about HAZCOM, to know how to understand it. And the safety data sheet will state which gloves, because some gloves, nitrile, not protective. Full body protection, including hood and booties. We want to make sure that nothing is exposed and that could possibly contaminate it. You want to have everything covered up so when you're doing the decontamination, you're not bringing anything out. The other thing that's required is respiratory protection. The CDC has recommended a minimum of what's called an N95, otherwise known as a filtering face piece. This is basically a paper mask, but it's not a medical mask. And there's been a lot of information out there by the CDC what we're talking about. That's the minimum. Some companies and some personnel have decided that they want more than the minimum, which means it could be a half-faced or a full face. If they use a full face, which one good thing is you don't have to worry about safety glasses or goggles because the entire face is protected. So you can do that. That's up to the remediation company. It also depends on what chemical you're using. Okay, and as I mentioned, you need to make sure that the personal protective equipment is docked or removed appropriately. Because if you do not remove it in the correct order, you'll end up contaminating yourself and possibly the employee would contaminate themselves or possibly bring contamination outside the area. So what we're explaining to people working in the area that they need to do personal hand hygiene, which means washing with soap and water, although usually in the decon area, they have to rely with the sanitizers between steps. Anytime that the gloves are off and now they're taking off other parts of their PPE, you need to wash in between. And they also need at the end to wash or use an alcohol-based sanitizer immediately after remove the PPE. And also the PPE has to be removed in one particular area. If the workers are putting on the protective clothes, it doesn't matter where they put it on, but they must take it off at the same area that is set down with poly or something like that to keep you from contaminating it. And I'm sure you'll hear a little bit more information about that. Okay. We suggest that you have a trained industrial hygienist to verify the job. The role of the industrial hygienist is, number one, to take lots of pictures to see what's going on, checking that the contractor scope of work is being followed. They want to determine who is doing the job, which personnel, put the names down there, what PPE is being used, what cleaning methods, including chemicals, being used, how decontamination is being performed, and how waste handling is being performed, because you need to have all information documented. The person is overseeing to make sure that everything is followed appropriately. And this way we can verify that the work is being performed to give you a little bit more sense of that everything was done appropriately. Now we talked about disclaimers, just to let you know that a company could come in and clean an entire building, get it decontaminated, get it cleaned. The people come back in and somebody walks in that didn't know they have COVID and can do it again. Okay, so what the documentation is stating that everything was fully done to give you peace of mind. So some people say, well, I don't really want to spend the extra money to have an industrial hygienist. Well, if you don't have a third-party person watching what's going on and stating that everything was done appropriately, then there's no verification. Now, I know there are some great remediation companies, but we can't document that the PPE was worn appropriately, if it's correct cleaning took place, or if everything areas of concern were cleaned. Not just the person's office. You want any area he or she may be wandering around, the lunchroom, the lobby, the restrooms, whatever. So we did have a case, Hillmann had a case, actually two cases at this point, where companies came in, they did their own cleaning, they did not have a person on site, and they wanted verification that it was cleaned appropriately. And since we could not do the verification, the cleaning had to be redone. So just to let you know about that. So that's why we highly suggest that you do have an industrial hygienist. I know we're going to do questions and answers. So what I'm going to do at this point, I'm going to stop the share, and I'll be happy to answer questions later. Thank you.
Thank you, Jill. That was great. We are gonna, I just want to do a reminder, we are receiving some Q&A questions from the group. Keep them coming because we will go over them at the end. I want to just remind you, it's just Q&A. Do not raise hands or go into the Zoom chat. It's just the Q&A section. I'm going to turn the floor over to Caitlin Bauman and Andy Goldberg. Again, we'll have about 15 minutes with the two of them. Over to you guys.
All right, perfect. Can you all hear me okay?
I can hear you.
Okay, perfect. All right, wonderful. That made me nervous for a second here. All right, so let me just share my screen so you all can see my slides. Give me 1 second here. Bear with me 1 second. All right. So you should all now be able to see, it's a list of, it's called Planning for Pandemics. Are you all able to see that okay? Amy, Erica, can you guys confirm, are you able to see my slide?
We can see it.
Okay, wonderful. All right, so good morning, everybody. My name is Caitlin. I work for RestoreCore. We're a disaster planning company. So what I wanted to do is spend some time this morning talking about what you can do, yes, of course, in advance of something like this. But since this is so unprecedented for all of us, I wanted to make sure we spent some time talking about the questions that you and your team should still be considering to make sure that both from a corporate level and a property level, your teams are as prepared and as safe as possible. So I know we've got some limited time, so I'm going to kind of run through these relatively quickly. But the first point here, and what you see on the screen, are some top questions that you really should be considering from a corporate, regional, and property level. So if you have not already, please make sure you have discussions about what kind of risks of exposure exist within your communities. And you want to think about the things that make your communities different and changes that degree of exposure, right? So when you're talking about a garden style community that has a very different type of risk than a high rise, for example, or perhaps you manage a property where there's retail on the first floor. Because what you want to think about is not only the type of building and type of community, but who all's on site every day. And we're talking about not just your residents, but any visitors, family members, of course your staff, but maybe contractors or vendors that you have coming through. Any retail visitors, whoever it might be, think about who is moving through your space on a regular basis. Of course, the more people, the more exposure you have to something like this. So you really want to sit back and think about your portfolio and think about the different risks associated with those different types of properties. The other piece of this is thinking about how can you support continued business operation. I think we're all at the point now with this where we're feeling moderate to probably significant strain on our operations. So you want to really sit back and think about what is essential and what is non-essential. And I mean that in the framework of your employees, any tasks that need to be completed, the services that you offer, whether it's from an outside vendor or the work orders that your service managers are providing to residents. You want to really think about all of those things that you are offering or those different elements of running your business, what is essential to maintain operations, and what really can kind of take a seat on the back burner as we work our way through this situation. Along a similar line, you want to think about, those units or common areas that might have varying levels of exposure, right? Maybe, God forbid, you may have a resident who's confirmed to be positive with COVID-19. How will your team manage any kind of service request in that unit, right? That's going to be a very different approach than if you're fulfilling a work order in a community space where there's no known exposure. And of course, because there's no shortage of gray areas with this, and we're going to talk about the tiers of exposure here in a little bit, but those areas that have suspected exposure, but it's not yet confirmed. How will your staff handle providing any of your essential services in those areas based on the exposure. So you want to think about those different elements. One of the most important pieces of this, and it's so easy to overlook it, but it's communication. You can have the best plan, but if you're not communicating it appropriately to the different parties involved, it loses a lot of its value. So you want to think about, of course, your plan, but who are you communicating it to, right? Your staff, your residents, any vendors that might be on site, corporate, moving it not just up the chain, but also down the chain, who from the property level all the way up to corporate management need to be aware of what's happening, what the next step is, any challenges faced, and what they need to prepare for. So you want to think about what you have to communicate, who you have to communicate it to, and how are you communicating it to. Depending on your residents, you may have a community where they're very responsive to social media content, and I think Ellen might be talking about this in a little bit. How can you use social media to help get your message out to your residents? Same thing, you might have some properties where maybe you offer robocalling or texting or you post flyers, whatever it might be. Think about what your residents are most responsive to and what's most conducive to the message that you're trying to convey to them. And the other piece of this is to think about who is responsible for that communication, okay? So when you think about kind of the five W's, right? Who's communicating, what are they communicating, who are they communicating it to, and how and when, right? So you want to think about all those different elements when it comes to communicating your plan. And that's the piece that is so easy to overlook sometimes. And then lastly, and this is by no means an extensive list, but one of the other really important things that you all need to consider is how are you going to support your staff during this pandemic, or hopefully we don't go through this again, but any future pandemics. You need to understand and determine who in your team is responsible for disaster planning, who's going to make the call to initiate that plan. I mentioned assigning roles. You want to step back and think about, during our pandemic response plan, who is responsible for managing operations? Who's responsible for communicating to our residents? Who's responsible for maybe maintaining communication with governmental agencies, local health officials? Who's handling media concerns? For any of you who have been in this industry long enough, you know, and I'm sure you can anticipate that if it gets out that you have someone either on staff or a resident at your property who's confirmed positive, right, this now becomes a PR concern as well. So how do you appropriately handle the media? Who's allowed to communicate with them? What are they allowed to say? So you want to make sure that you're prepared with that plan, those assigned roles, and that proper messaging. And of course, you really want to make sure you think about what happens if your business is either significantly interrupted, if certain aspects of it need to be temporarily shut down. You know, Amy did mention that housing is considered an essential service. So, you know, we're not quite as affected as the restaurants and hair salons down the street, but this is something that you want to think about, what happens when you have to plan for sustained business impact. So those are some of the kind of basic questions. We do have a resource that we are happy to share with everybody with a more extensive list to help facilitate those conversations. But for the sake of time, what I want to do is talk about very briefly the 3 levels of community response. So when I say community response level, I mean the degree of impact of the pandemic in your close and local community. Level 1 is a very proactive response to a growing concern of transmission in the United States. We all know we're past this point, right? This is your proactive kind of education-based approach. You know, you might be increasing the application of disinfectant to your common areas. You might be educating your residents on good hygiene. You might be providing personal hygiene supplies. We're all past this point at this point right now. So level 2, when you think about this, it's more of it's a reactive response to a confirmed transmission within the region. This is when you really start thinking about the impact of having increased staff absenteeism, whether it's due to illness, school closings, daycare closings, travel restrictions, right? This is where we really start to feel the strain on our business, where our teams are feeling the strain on what they're able to do, both professionally and personally. This is where you absolutely want to continue that daily, if not hourly, or multiple times a day application of disinfectant. But this is where, to Jill's point, you really want to start thinking about engaging with a professional who has the training and certifications that Jill mentioned, who has the experience in biohazardous cleaning, and who has the proper PPE to protect not just themselves, but also your residents and staff. You want to make sure and think about what service requests your team is still prepared to attend to. And then you want to communicate that list to your residents, right? So start thinking about what are those essential services that you need to provide to your residents, and what are the things that may need to take a back seat for now. You want to make sure, and we strongly recommend at this point, if you haven't done so already, closing access to common areas. So your community rooms, fitness centers, clubhouses, whatever it might be. But in an effort to really implement and encourage social distancing, we strongly recommend that if you have not done this already, please really consider closing access to those common areas where you are likely to have a higher gathering of people. Level 3, and this is where we're probably sitting somewhere between level 2 and level 3 at this point. Level 3 is a very urgent and reactive response to widespread community transmission. A lot of times what comes with this is a strong possibility for a shelter-in-place mandate. So for those of you that have heard about what San Francisco has done, where they've put the city on a shelter-in-place mandate. So this is when we really start to talk about a strong and sustained impact to our personal and professional abilities. So you want to start thinking about, the restrictions and boundaries that you know have to work with when your travel is severely restricted. There might be curfews put in place, widespread closures. At this point, this is when essential services are the only ones allowed to continue operation. Now, with housing being an essential service, you might want to consider having an essential services letter that you can equip your team with. If anyone from your team has to travel to a property, consider providing them with an essential services letter. That way, in the event that they potentially get pulled over by a police officer while they're driving down the turnpike or wherever, they're able to show documentation that they are en route to provide an essential service.
Hey, Caitlin, this is Paul. I have prepared that letter, and I think that we can put that up there if Ellen could add that so everyone can see it. Here's a sample letter that you can use.
Perfect. Perfect. Thank you for that. This is where you definitely also want to tell your residents that you will be only servicing emergency or essential service requests. And you will probably need to define what emergency is, right? We all know that residents will have their own definition of what an emergency request is. So your team needs to be crystal clear on what that definition is, and then make sure your residents and staff are all on the same page with that. At this point, you want to make sure your staff and residents are educated in what it means to shelter in place. We may very well find ourselves in a level 3 situation in the coming days, weeks, whatever it might be. So I strongly encourage talking to your residents and your staff about how they can prepare for potential shelter-in-place situation. We kind of just talked about this, the essential services, and it sounds like Paul's got a great resource for you, so I won't take up time talking about this here, but I do want to pass it over to Andy to talk more about our exposure tiers and kind of how we're servicing these areas.
All right, thank you, Caitlin. Appreciate that information. Just so everyone knows, we do have that resource that we have sent over to the Pennsylvania Apartment Association, and I believe Marlon and her team is going to post that information on their site. So feel free to have that information. Feel free to jump onto that website and take that information and use that to help build your plan. And there's a little bit more detailed information in that packet as well. So what I want to talk about now is how we are responding to the COVID-19 requests that we're getting to provide service. So there's 3 different types of requests that we have gotten for COVID-19. And we've broken it down into 3 different tiers. So tier 1 is no known exposure to the virus. Tier 2 is there's a suspected but unconfirmed exposure, and then a tier 3 is a confirmed exposure. So what we have done is we've done 3 different protocols for each of those 3 different exposures levels. Obviously, if there's no known exposure, that's going to be the least amount of PPE that we're going to be wearing, and it's going to be the least expensive service that we provide. And when I say we, there's a lot of contractors out there that are performing these services. So I'm speaking for the general restoration and cleaning industry when I talk about we. But we've gotten a lot of requests for tier 1, which I just call a bioload reduction. So we're going in there and we're doing preventative cleaning so that if there is possibility of some COVID or coronavirus in your building, that we're just doing a wipe down of those affected areas and then doing some fogging of the property. What we're looking to do when we apply this commercial grade disinfectant is that we are trying to have a dwell time of at least 4 minutes, but in order to kill the virus. But what we try to do in practice is make sure that we apply enough that it takes about 10 minutes to sit there so that we're getting the minimum 4 minutes of dwell time. When we do that type of work, the personal protective equipment that we're using is for the most part, let's slide over here, it's just N95 masks and gloves. Now the issue that we have is that the N95 masks, right now, when we have plenty of them right this minute, but we are sure to be running out of those probably within about 2 weeks or 3 weeks. We are then going to have to be going probably to a half-face respirator. When talking to my supplier, who is one of the largest suppliers of N95 masks, at least in our industry, is that the next shipment that's confirmed for them is in June. So, and who knows if that's even going to come. The federal government has literally requisitioned all masks for hospitals and governmental use, and China has banned the export of N95 masks. So if any of you guys have the ability to make N95 masks, you guys will all be billionaires by June. And even some gloves are in short supply. So these are some of the issues that we're dealing with. Tier 2 and Tier 3 are very similar in our personal protective equipment that we're using. So when we're going in to do a Tier 2 or Tier 3, it's a similar scope of work that we're performing, but we're performing it in a higher level of personal protective equipment. So at that point, we're wearing full Tyvek suit that has booties on it. We're wearing 2 pairs of rubber gloves, and then we're taping the rubber gloves to our suit in a full face respirator. That's what we're using, and that's what I know a lot of other contractors are using as well. Others may have different protocols as well. But when we're done out of a Tier 2 or Tier 3, which is where there's either a suspected or confirmed case, we're being very careful and specific in how we don and doff this equipment. You're taking the mask, you're pulling it off over your head. Well, first of all, when we're done, we're spraying, our technicians are spraying themselves down with the commercial disinfectant and letting that sit for 10 minutes before they start taking their equipment off. Then they're taking their mask off, pulling it off their head. They're taking the Tyvek suit, they're rolling it off in a very specific way while standing in a trash bag, and then taking 1 pair of gloves off after they take the equipment off, and then there's another pair of gloves. The second pair of gloves is basically to take your PPE off, to be wearing while you're taking your PPE off. So we take it in a bag, we seal the bag off, and then that's disposed of with the other supplies. So I think Jill touched on the PPE training, but probably most people in this world never really heard the words donning and doffing of PPE until now, and after this is over, I think everyone will know what it means. So just move on to so that's it in a nutshell. If anybody has any questions about that, we have performed quite a few services. We had a case 2 days ago where one of our clients called us and said that they got a call from one of their prospects that said, yes, we definitely do want to rent that apartment. The only problem is that we just tested positive for COVID-19, and your building and your leasing agents have been affected, so, or have been in contact. So in that case, we went in there and we did a tier 3 cleaning. Most of the work that we've done has either been preventative or tier 2, where somebody is under quarantine because they came in contact with somebody that had it. Based on the rate of transmission, my guess is that some of those tier 2s are going to end up testing positive, and I wouldn't be surprised if many members of our association are going to be dealing with tier 2 and tier 3 cases in the future here coming up over the next couple weeks. So that's all I have, and I will send this over to you, Ellen.
Thank you, Andy and Caitlin. I love hearing the real life experiences. That's so helpful in our industry. I wanted to go over a couple of things. So I've been getting a lot of questions. Are we going to share everything? We are going to share everything on our website, so you will have access to that. I'm not sure if we'll send an email afterwards, but I'm sure if you're registered for this call, we have your email address, so we can send some updated information as well through your registration for the webinar. Next, we're going to have Ellen Thompson speak to the group. So Ellen, over to you.
Great, and I think that Paul and I are going to kind of tag team the communication strategy because it really overlaps tactics around communication as well as legal. So the first thing that I want to show you, and I'm assuming everyone can see my screen, is the letter that Paul referred to. Can someone indicate they can see my screen from PAA?
Ellen, I cannot see your screen. We have your slides up for your presentation part. So
we can see the screen, Alan, but not the letter.
Yeah.
Okay.
Ellen, if you want to send the letter to Erica and I, we can try and get that up too before the end of the call.
Okay.
And we also will have it on our website. If anyone wants to go there, they can find it.
Okay, so you can see my COVID-19 screen, but you can't see Paul's letter. Okay.
That's correct. Yeah,
and just so everyone's aware, that's the letter that you would take with you in case you got stopped to show that you have an essential need to be at your employment. So it's something that you should have your employees carry with them. Obviously, you don't need it now. The government isn't really checking, but that's coming. It's just a matter of time till that's here. So we want you to be proactive and have that ready to go.
All right, terrific. So I'm Ellen Thompson. I've been in the industry as a vendor for 18 years, and I'm the founder of 2 companies, 4 Walls, which trades as ResPage, and also Results Repeat. And my role has been in marketing and messaging for apartment communities. And during the last 18 years, I've seen my clients go through countless emergencies and events that require a unified message. And so I'm basically taking the baton from Caitlin to talk about communication strategy. And briefly, I've been in the middle of a lot of communication in multiple states around COVID-19 messaging. So I'm here to share some lessons learned, to give you a sense of what your peers are talking about. I've aggregated all of the different topics people are talking about, and also to give you some specific strategies around how to use technology tools that you already have in place to get the message out. And so what I'd like to do is just hand the baton off to Paul to introduce himself, and then we'll go through our slide deck.
Yeah, thank you, Alan. Paul Cohen, been representing landlords for 35 long years now. Getting very involved with this topic, unfortunately. Just a quick disclaimer. Yes, I'm an attorney. Yes, I've been researching this, but nobody is an expert on this. This is something brand new. We're all working through this together. We're going to give you best practices, what we believe is the best practices. But like I said, check with your local attorneys and check with your attorneys at your company to see what they think is the best practices. Everyone's going to have a different idea on this. And quite frankly, the ideas are going to change. So the talk that I thought about giving when we first talked about this is completely different from what it is today. And I can tell you it's going to be completely different in another week. So we'll see where it goes.
Okay, so let me just verify that everybody can see the slide that says overview.
No. We're still on your first slide.
All right, I'm going to stop the share and reshare, and hopefully that works.
We can see it now, Ellen.
All right, terrific. You know, it's really funny. I'm the one with the virtual company, and I'm the one with the technology issues.
Yeah, but we knew you'd figure it out.
That's what this is about, really. And I think that's a good lesson for all of us. So again, I think the first thing that I'd like to layer in here is that the communication is not just to one party. We're going to be talking about communication to your staff, to residents, to suppliers, and also to prospects. So what I've done is I've basically aggregated a list of things that you guys are chatting about already. And my hope here is that you can get some ideas of what other people are talking about. What I'm going to do is I'm going to go through the information on this slide, and then Paula is going to weigh in on anything from a legal perspective. So first of all, I want to talk about staff communication. It's really important for staff to understand what is going on so that they can remain calm and they can remain informed. So some of the things that you want to consider talking about and are considering talking about are, first of all, changes in the workplace or work rules. So many companies are having non-essential staff work from home, which is a new thing. And also work schedules are being changed. So sometimes leasing offices that have 3 or 4 leasing consultants or property management staff are rotating who's working. So making sure that people understand those schedules and understand how to work from home and what is respected of them are some of the things that you guys are sharing. Additionally, cleaning requirements are being updated. So notwithstanding Caitlin and Andy's remediation that happens after a person of interest enters the picture, organizations have ramped up cleaning, and there needs to be clear communication about the schedules within the staff. In addition, we're seeing changes in policies. So leasing hours are being changed by some organization. Remote tour options are being offered. So we see organizations offering FaceTime tours instead of real-time tours, or doing video recordings of vacant apartments and posting them online. The other thing we see is tour policies are changing. So for instance, we've seen clients where occupied apartments are no longer being toured as a way to protect both parties. And of course, we are starting to see amenity restrictions. We've seen a lot of confusion around this, but we see more and more folks shutting down common areas, which again is a best practice at this point.
Can I address that, Ellen?
Absolutely.
Okay, so we've gotten a lot of questions with regard to this. And generally speaking, the government is saying that if there's going to be 10 or more people congregating together, that should stop immediately. Local governments are saying 25. There's no magic number here. With the social distancing, 2 is probably going to be the number at some point in time. That's where we're heading. So the sooner you shut down those amenities, the better off you are. If you're not doing it now, I understand that it's a business decision, because you're going to have a situation on the back end where the residents are going to be saying, well, if there's no amenities, we're not going to be paying for those amenities. So that's going to be an issue that you're going to have to deal with on the back end of all of this. And we'll address that at some point in time in the future, not today. Okay. But for right now, for best practices, you should probably shut down all the amenities. We have to deal with the health, safety, and welfare of your residents and your employees. The government is now in a state of emergency. Federal government is in a state of emergency. There's a state of emergency declared in the states, federal, and locally. What does that mean? That means that the government can pretty much do whatever they want in the name of the health, safety, and welfare of the citizens. So, as you know, there's now a closing of essential businesses. Government can do that. They can have curfews. They can have shelter in place. They can call out the National Guard. All these things can be done, and your civil liberties really are being taken away. It's a good thing, not complaining about that, because we're trying to protect everyone's life, essentially. So in the name of doing that, the government can go ahead and shut down all these different things. The same way the government can do that, you need to think about that for your business. Meaning that people ask me all the time, what about fair housing laws? What about the ADA? What about HIPAA laws? What about privacy laws? Well, when it comes to the health, safety, and welfare of your residents, that's your number one concern. So if a resident has coronavirus, known case, they're quarantined, okay? Can you disclose that to the CDC? Absolutely. Does not violate privacy rules. Okay, CDC rules and the health, safety, and welfare of your residents comes first. That's your number one consideration. Always think about those things, okay? Obviously, do the disclosures in the least obtrusive way possible. So if you don't have to give the person's name, do not. If you don't have to disclose the actual unit number, do not. Try and think about those things, but the number one concern here is health, safety, and welfare. I can't say it enough, of your residents and your employees. That comes first. Okay, you, Ellen.
Thanks, Paul. So the other thing that's really important is to make sure that accurate information is disseminated. And this is a rapidly evolving situation. And just this week, there are medical journals that are saying that COVID-19 might be airborne. So we don't know if that's true or not. So it's really important to keep on pushing people to official sites like the World Health Organization or the CDC. There are a lot of rumors out there, and it's easy for people's minds to go crazy. So just keeping folks focused on the facts as much as possible, again, to create that sense of information and calm. So your communication strategy also has to help communicate the facts with your residents. And some of these things are overlapping with what you're communicating with your staff, but the messaging has to adapt to think of the point of view of the resident. So again, leasing hours are changing. Workplace conditions with work from home are changing our residents' lives, but also changing your leasing lives. I've seen properties share contact lists so that in the case someone has to work from home, they can reach the cell phone of their property manager or maintenance manager, or have the emails close at hand. Resident event cancellations are pretty much the standard issue right now. So communicating those things are happening, is going on. Updated cleaning standards are very similar communications to those going out to the staff. Explaining that amenity space access has been temporarily ceased and that rentals are no longer available is also something that's gone out. And to Paul's point, we may have a backlash in terms of people feeling like they're paying for those rent amenities and they can't use it. But what I've seen happen in the last week is that as the issue becomes more prominent and more real to people, I think that people are backing off on their anger. So I'm hoping that that will make our lives easier, that everyone realizes we're sort of at war with an invisible virus. Talking to residents and about remote tours, especially if they have if they're in a medical, if they're in some sort of graduate program and they have folks to refer. A big issue in the next couple of months is you have resident matches and you have graduate schools that are announcing who got in, and so we still have the need for apartments to rent, and resident referrals are still going to continue to be an issue there, and it might be easier to rent to someone who's a resident to a referral from a resident. So again, sharing that remote tours are going to be a possibility for those properties supporting it. Also sharing the tour policies, that they can feel safe, that their apartments are not going to be toured. And again, just making sure our residents are staying on top of the facts through CDC or World Health Organization websites. Paul, anything to add?
I do want to talk a little bit about evictions, if I could.
That's coming up. Can we push that to the slide about evictions, or you want to do it now?
I can do it now.
Okay.
one of the big questions we're getting is whether or not you can still file for evictions and what's happening with the courts. What we started to do was to start keeping track of all the courts that you can file on, courts that are still open, whether you can do a lockout. There's basically 3 phases that you can think of with regard to evictions. There's obviously the lockout phase, there's the court phase, and there's the filing phase. We are going to post on our website, I guess we already have, and I know Janelle, my partner, has done a little video which explains what all the different courts are doing. The problem is that this keeps changing by the hour. The bottom line of it all is that you pretty much can't do any lockouts for right now, anywhere. When I say anywhere, there's still a couple places which still allow you to do that, but it's only a matter of days before that's all stopped. Court hearings. You pretty much can have a court hearing for a landlord and tenant case anywhere. That's pretty much stopped. There's a couple places that still allow it. Bucks County was allowing us to do it telephonically. They've stopped that as of today. And the other courts, I'm sure, are going to follow suit. So you're not going to be able to actually do it. Yeah, go ahead.
Paul and Ellen, we're not seeing the slide. If you could, I don't know, Ellen, kind of reset it so we can show the group. Because we're not seeing the slide on evictions.
We're not, the slide on evictions is later, and Paul wanted to talk about it now.
It's okay.
Okay.
You don't need the slide for right now. It's okay. I can keep going with that.
Sounds great.
It'll make sense. No problem. Okay. So there's no court hearings at this point in time, but the courts are still allowing us to file the cases. So the question becomes whether or not it's worth it for you to file for the eviction case. The concern we have and what the courts are telling us is that at least if you file the case, you get into the queue. If you don't file an eviction case now, what's going to happen is when they start allowing you to go to court and they start allowing the actual lockouts, if you haven't been in the queue, you're going to be 5, 6, 7 months out before you're going to be able to do the lockout. So our suggestion is that you file the case so that at least you get into the queue. If the person pays, if you're able to work something out with them, and we strongly suggest that you do try to work something out with the person, especially someone who just lost their job, but you think they're going to get their job back and you think they are going to be able to pay. They've been a good tenant for a really long time. Absolutely try to work something out with them. You can still file against them. You can always go ahead and pull the case. We're contacting the courts now to see if they can work with us to be able to pull those cases before they actually file them. It's going to be a little tricky for them because they're going to have so many cases that are going to be backlogged. We're also trying to work with other attorneys. We've contacted them to see if they'll work with not charging landlords to file the cases and just put them into the queue. We think that's really important so that you don't get hit on the back end. A lot of courts are also asking us to please file the cases now so that they can work through them. Because if we don't, what's going to happen is once they do allow for the court hearings to take place, they're going to be inundated with all these cases that they have to process. So if they can start processing the cases now, that will help the court to alleviate a lot of the backlog and a lot of the work that they're going to have to do when this all gets cleared up. Additionally, the tenants will not be notified that you filed the landlord and tenant complaint. They won't get notified until everything opens back up and a court hearing is scheduled. So you can file the case, get it into the queue, and just leave it in the queue, try to work things out with the tenant. If you're not able to work things out with the tenant, then you can go ahead and continue with the case. If you are able to work it out with the tenant, you can withdraw it. But at least you're in the queue so that you can get a hearing in, I was going to say a reasonable amount of time, but I'm sure it's not going to be considered reasonable even if you do get into the queue and get started early. So that's our advice on the filing of the cases and the court system. We're going to keep a list of all the courts as they start opening up. We're starting to be proactive here and thinking long-term. So the goal here is to think long-term and then work our way back, instead of what most people are doing is saying what's happening today and then worrying about today, and tomorrow. We're trying to say, okay, here's what's going to happen. Let's start working our way back. So is there going to be a shelter in place that's going to happen? Most likely. Are they going to stop all evictions and all filings? Yes. So if we're trying to be a little proactive here and get our cases filed prior to that all happening, so they're at least they're in and you can start proceeding. Now, I understand the optics of this, and that's something that you have to work out as a company. Do you not, you want, sort of don't want it to get out that you're evicting people in the middle of this crisis, okay? That's something that I guess Ellen can speak to more as far as the communication of all this goes. And that's something that you have to weigh as a company and how you want to handle that. There's obviously people that are just bad tenants. They're just going to game the system. So they're the ones that you absolutely want to get into the system and filed on, because they're going to game it as long as they can, and they're never going to pay you, and they're just going to continue to live rent free as long as they're able to. Thanks, Ellen.
All right, thank you, Paul. So other things that we should be thinking about are how we communicate. So we talked a little bit about what we're communicating, but you can mitigate a lot of risk and you can make people feel a lot better about when you communicate the right way. So one thing that is incredibly important to our staffs especially is an attitude of gratitude. So I've heard a lot of leasing agents that are over 60 are starting to talk to their employers and say that they're nervous about their working at all. And maintenance folks are also deeply concerned. It's really important for folks in leadership positions to have a cadence of communication that's very regular, at least weekly, and to express thanks. It goes a long way. It's a really difficult situation if people are stressed out, and saying thank you is something that's free and can make a big difference. It's also really important to view communication from a very customer-centric approach. So put yourself in the shoes of that person. So to go back to Paul and his advice regarding evictions, are you going to have a negative impact on social media and reputation as a result of evicting people during a crisis and beginning those proceedings? Absolutely. How you can mitigate that is you can try to work out situations as best you can. So that way, when you are choosing to respond to those negative reviews on social media, which are inevitable, you can choose to have the optics that you tried to work things out. And it definitely is a crisis. So it's anytime you evict someone, anytime you fire someone, there is a risk situation and people do lash out online. And it's just a matter of how much risk tolerance you have. That said, when we do reputation management, we always tell people to look at what's going on at competing properties. And if we're all in this together, we're going to see evictions among your comps. And so they're going to have the same business risk and the same possible negative reviews. So again, it's just something that if you think about in advance how you're going to handle, and you think about the business risk in advance, you can make a decision that's going to work for your company. And I think something that's also really important is that different organizations have communication that's centralized or decentralized. I think it's really important at this time to make a centralized decision and give folks at the community level some guidance in terms of what you want to communicate and what is off limits for communication. I don't think that you can assume that it's fair to put the responsibility for communication protocols at the property level. I think it will make most people uncomfortable. And second of all, I think if you are in a leadership position, you can't assume that people know what is you can say and what you can't say. So, skipping ahead to a slide, there are privacy laws. You cannot disclose information about folks who have coronavirus. We still have some civil liberties even in the middle of a crisis. And, so you don't, it's something as simple as you don't want your property managers going onto their own personal Facebook pages and talking about, oh my goodness, we have a coronavirus case and in unit 3B. I mean, that's just disastrous. So I think you can't assume anything. You can't assume that people understand what's right and what's not right to do. So, but I think the most important thing is just to have some empathy. If someone's lost their job as a result of this, I mean, that person is going through a hard time. If someone has a relative with a chronic health disorder and they're worried about going into work, that is something that's a very real situation. If your vendors are calling you, they have bosses who have quotas and they're just trying to make their numbers. So a little bit of having a little heart in the conversation and a little bit of empathy goes a long way to reducing the risks of negative publicity, and also the more that people feel like they understand the better. So example, with amenities closing down, like one of the things that's a real fact is if your gym is still open and you have a positive coronavirus case, then that gym has to be disinfected. And so obviously we don't want to be communicating to our customers that we have the risk of extra expense if we have to decontaminate a common area, but it's more like it's for the safety, health, and well-being of our residents that we're making these changes. So it's really about their safety, not about our trying to mitigate risk. So again, just when we're communicating, it's really important to take a deep breath and to think about the customer first and to modify your approach to communication based on who you're talking to. And again, the frequency of communication is really important. You can't communicate too infrequently. People are nervous. It's important for managers to have one-on-ones and let people talk. It makes people feel calm. And even if you can't change the situation, you can change the optics in terms of the frequency of communication. And again, one of the things that is completely absent in communication is what do we tell our vendors? So some vendors are essential service vendors. What are the protocols for their deliveries? Other folks are, startups, venture-backed startups that are trying to get your attention. And again, it might be better for them and better for you to have a polite no, or to ask them to communicate with you in 60 or 90 days out, just to make sure that they don't continue to fill your inbox if you don't want to see those inbox notifications. And it just gives them, lets them redirect their energy in a way that's more positive. Anything else in terms of approach, Paul?
No, I think you covered it.
So another thing that's important to think about is what's coming down the pike. So Paul spoke about evictions, and we don't have a slide with the specific courts and the procedures that he talked about, but I think, Paul, it would be a really good idea to put something together that we can update and have it hang on the Pennsylvania Apartment Association website so that everybody has access to everything you said. But
yeah, and just so you know, I've been updating the National Apartment Association for Pennsylvania, New Jersey, and Delaware. Other attorneys are updating the information throughout the state, and I believe they do have it up now. I just saw an email while we're talking that it looks like that should be up on NAA's website, which will have up to the minute information across the country. We will also have it on our website, and we'll get it over to PAA as well.
Thanks, Paul. And then the other thing that's coming down the pike is that the government has the Families First Coronavirus Response Act, which also includes the Paid Sick Leave Act of 2020. It's passed the House, and I believe it's still sitting on the Senate floor, but it will pass in some form or another. But the Paid Sick Leave Act is something that's evolving, but basically what it's proposing to do right now is require organizations to provide paid sick leave for even if you offer sick leave, paid sick leave on top of your current paid time off, and also sick leave and time off for taking care of children who are not in school, and also relatives that might be sick. So I don't want to go into too much detail about what's in the act because it hasn't passed, but this is going to have a huge impact on anyone who employs people. And that this is an example of an evolving situation where you're going to have to figure out how to field questions. And Paul, you want to jump in on this?
Yeah, so right now they're talking about it affecting pretty much all businesses, not just businesses with more than 50 employees. They're also in the Senate talking about possibly limiting that. We're not really sure how that limitation is going to play out. They're going to try and help small businesses, I'm assuming. that are going to be negatively impacted by this in a big way. But basically what would happen is the first 14 days, the person wouldn't get paid, or they would use their normal sick leave. And then after that, this would kick in for a certain number of weeks. They're talking about probably about 10 weeks. And this is in addition to the Family and Medical Leave Act, which doesn't really pay people. That just gives them the opportunity to take off for that. This would be separate where they would actually get paid. And then the question is going to be, is the government going to help to fund this as well? So there's going to be a lot of government funding. I'm sure you've all seen that. There's, according to our president, a huge package coming, which is great. It's wonderful, but we'll see how the money's going to be spent.
So this is an evolving situation, and most of us are in small business situations. And even if you're a larger property management company, every single one of your LLPs is a small business. And, you know, this, if you are down 2 of your 3 office staff, it's a real hardship, and you basically will have to retain those positions and figure out how to staff. So I think the most important thing is for us to keep everybody as healthy as possible, to minimize this, but this is going to be an expensive toll, both in terms of staffing as well as financial obligations for employers of all sizes.
One of the questions I get a lot is, you have an employee, a maintenance technician that voluntarily decided that he's not going to come into work. He doesn't have coronavirus, but he's afraid of catching it, and he doesn't want to show up. What can you do with regard to that employee? This is a huge gray area that we're not really sure how it's ultimately going to shake out. The laws, the way they are now, is that the employee doesn't have that option, so to speak, that their employee at will. And if they're not voluntarily, if they're voluntarily choosing not to come to work, then you could, in theory, fire that person. Is that heartless? Is that a problem? Is that bad PR? Is that bad for your other employees? You know, that's something you have to decide on a situation by situation basis. How desperately do you need that person? How much exposure and how much risk are you really exposing that person to? These are all questions that we don't really know the answers to right now. Unfortunately, in this situation, there's more questions than there are answers. We don't know what laws are going to be passed to protect that employee down the line. We don't know how unemployment's going to deal with this situation, but we'll stay on top of these things, and we'll try and keep you posted as things develop.
So as Caitlin said prior, one thing that you can do is decide ahead of time who is going to be responsible for each aspect of the communication. And it really is a multi-tiered process. Someone who's going to write the message, who's going to approve it, who is going to then make sure that information gets syndicated on your website and online media. And also, how are you going to handle your escalation policy? You know, if somebody at the site level can't answer a question, who do they turn to answer those tough questions?
So I'm going to give the 2-minute warning here, so we can head into our question and answer portion of the call. Paul, Ellen, anything else left to add?
We'll just wrap it up with a minute. So if you have a COVID-19 infection, you're going to find out from the health department or your resident or your employee, and that's going to dictate how you respond. But again, you need to lean on your local health department in terms of what you can and can't say. And just some brief communication tips. So don't forget, you have communication systems. Just think in advance how you're going to use them. One thing I want to point out in particular is if you're changing your leasing hours, leasing activity is still pretty brisk with a lot of my clients. Make sure you update your Google My Business listing to have accurate hours. There's nothing more frustrating than showing up on a weekend and the office isn't open. Don't forget to update your website with those office hours. Also your property management software, it's syndicating to your online listing services. If your chatbot has an announcement feature, update that, and also social media posting. And really important, make sure you have logins available in case you need to access all of your systems remotely. This was a big issue during Hurricane Sandy where people just didn't have logins. So again, we need to think ahead of time as much as we can about what we're going to post, who's going to write it, how we're going to get it out there, and just consider you need different messaging styles and platforms to communicate to staff, residents, prospects, and vendors. And Paul, anything else to wrap it up?
Just to wrap it up, defer everything to the CDC from a legal standpoint. So you're not the expert. You should not be making a lot of these decisions. If someone has coronavirus, they're quarantined, you don't make the decision as to what you should be doing with the property. Get a hold of the CDC, let them make the call. Then you'll be protected on the back end. And I think we're ready for questions.
Thank you, Paul and Ellen. I appreciate all of that knowledge. It's amazing to hear how much knowledge we have so far, and it's just going to keep growing. I want to thank all of our panelists today. I've taken a look at some of the questions coming in and kind of grouped them. Jill, Andy, and Caitlin, I think this first group is for you all. So are there any communities taking security precautions, meaning they're concerned about the spike in theft and break-ins to apartments, to cars, with people, missing paychecks? It's really concerning. So do you have any advice on that line?
Okay, I'll answer that question, and Paul may even have something to say on that too. But at this point in time, I'm not aware of any of our clients that are taking extra security precautions other than what they normally do. And Paul even mentioned about the National Guard at some point in time coming in. So, I mean, I know that they're starting to stage down by the stadiums down in Philly for some sort of response if needed. But I think at this moment in time, I'm not aware of any. But I do think it might be something that you may want to put into your response plan, that if this becomes an issue and all of a sudden you start seeing reports of this, you may want to have a security protocol put in place. So it's just something to think about. And something that probably most disaster plans don't necessarily have in place because you're not really thinking about this type of situation ever occurring. But here we are.
Yeah, I don't think it's a big problem at the very moment, but I think it absolutely could be. And we may be heading in that direction. You've seen gun sales have gone through the roof now. There's a reason people are purchasing guns. Same way people want to protect themselves, you're going to want to protect your property.
Thank you, gentlemen. Again, Jill, Andy, Caitlin, this may be for you. A lot of the participants in this call have talked about, does the remediation company have an industrial hygienist to make the initial assessment? They've also asked who is responsible to clean and disinfect a residence apartment. And can you define what kind of PPE should be used by on-site maintenance staff if there is no suspicion of illness or cases on the property? For example, they say if it's an emergency maintenance situation where the toilet is overflowing, how do they respond and what type of PPE should they have on?
So I'll answer a couple of those questions real quick, and then I'll let Jill and Paul kind of jump in as well. As far as the question, as far as having an IH, I think that it's a good idea to have an IH put together a protocol for your property ahead of time and have one on retainer. So it wouldn't be a bad idea to have a company like Jill's, put together a cleaning protocol for your building and then to have them ready to go. So if you do have a tier 2 or tier 3 exposure, that they're ready to be on site. My personal philosophy on industrial hygienists is that I'd rather have you as the property owner hire the hygienist to check my work, because I think if there's ever a case where we're in a court of law, it's a lot better for them to be a third party that verified the work that we did was proper, as opposed to me verifying my own work that's proper. So I just think from a CYA standpoint, that's the better way to go. The other question was, what PPE should the on-site maintenance have? I mean, at this point, I would follow the CDC guidelines, and those are being updated on a regular basis. At this point right now, if it's an unaffected area, you're not necessarily required to wear any PPE. I can just tell you this from my standpoint: when we show up at people's homes and we're wearing a N95 face mask or another type of respirator, what our clients are telling us is that they're glad that, we say, look, we aren't required to wear these, but this is just for your protection and ours. We don't want you to be alarmed. And they've all said, thank you. No one's been like upset that we wear them. The only problem is that at this point in time, almost any type of respirator is unavailable. But what we've been doing because of the shortages that we have ordered some more of the half-face respirators, because those seem to be more easily obtained for our people to wear, and those are reusable. So you can get one respirator and you can wear it again and again and again, whereas the P95s are disposable. The other question I saw on here was about the laundry rooms, and what we've been telling our clients is that the laundry room is considered an essential part of for our clients, especially for our clients that are providing essential services. They need to wash their clothes on a regular basis so they can, some of the people that live in your buildings are providing essential services in other ways. They're nurses and doctors and policemen and firemen, so they need to be able to wash their clothes. What we say is the best practice is that you should set, and Paul, you might want to speak to this as well, is that, the laundry rooms are still open. We highly recommend, or we recommend that you bring down a wipe or spray to clean down the laundry room before and after, out of respect to the other people, before you use them. I think that if you supply any type of cleaning product in your laundry room, or publish that you have some in your laundry room, it will no longer be there within probably 10 minutes. So, we're hearing reports about people unable to keep toilet paper in their public restrooms. So, and then, I think the repair thing gets extremely tricky as soon as you have a confirmed case, right? I am confirmed COVID positive, and I have a backed up toilet. And that's a case where I think that's where the industrial hygienist becomes really crucial. That's why you want to have one, kind of like quote unquote on retainer. So I'll let others then jump into these questions, and I don't know if I missed any at this point, but.
Andy, really quick too, and this question just came up on our live stream. So a lot of our property members are asking, is it okay for them to ask the question before handing the work order if that resident has been exposed to COVID or if they are sick? I think that kind of goes hand in hand, yeah.
Right. When you ask that question, I kind of feel as though I'm probably like maybe violating maybe a HIPAA, but
absolutely not, Andy. It's
okay.
Absolutely okay to ask that question.
Before we respond to any of our clients, we are sending out a letter having them certify that they do not have COVID-19. So before we go, we are asking them to put in writing to us, through an email, that they do not have COVID-19, they're not feeling ill or any of those or anything of that nature. So that's what we're doing. I mean, on top of the fact that in between servicing our clients, we are having our crews basically decontaminate their vehicles. So any equipment we're bringing in and out of people's houses, there's a decontamination process in between. So
just real quick on the HIPAA rules. HIPAA only applies to covered entities, which are basically your healthcare providers and your health plans. It's more of a privacy violation that we're talking about here. And when it comes to the health, safety, and welfare of your residents and your employees, that takes precedent over any of these concerns. And especially during a national emergency and a pandemic. So you can absolutely ask them, because you're doing that to protect your employees and or themselves. So that is something that should be asked. Not can you, it should be asked to make sure that everyone's protected. Obviously, don't disclose that information to other people. Disclose it to the CDC, keep it private, but you can absolutely ask to protect yourselves and your employees.
Could we ask all residents that if they do if they are positive or see COVID, that they contact us?
Yes.
Or not, the ownership?
Yes.
So maybe there's maybe that might be another resource, Paul, that you could, help craft for the PA to put on that website with all the resources.
The potential violation comes into play with what you do with that information. And the key here is you want to turn that information over to the CDC, your local health professional, local health department, and let them tell you how to handle the situation. Once you do that, then you've done everything you're supposed to do.
Paul, the other question I guess would come up is like, let's just say, Unit 19 says, hey, or, Unit 19 or Unit C19 has COVID-19, right? So when they say that, then do you go back through your records to see who's been in that apartment over the past, 14 days?
So the first thing you should do is contact the CDC.
Right.
They'll guide you on what you should be doing. Then
Right. But at that point,
follow their guidance.
definitely want to be looking to see who was in contact if we did a maintenance request in that building.
Right, and I'm sure they're going to tell you to do exactly that, but you want to follow their guidance. You're not the expert. It's not for you to figure out how to deal with this situation. You're not best equipped to do that. That's where the CDC comes into play.
Yeah, we have a client in Seattle.
There's all sorts of liability issues that we're going to deal with on the back end of this. So
yeah, we have a client.
You contact the CDC, you're going to be protected.
Yeah, we have a client in Seattle, and one of their maintenance technicians tested positive, and then they had to go back through. There was like 8 units that he had worked in over the past week, and all the common areas. So I mean, it became a massive. I think it was like a $50,000 cleanup.
Yeah.
Okay, I know we're getting a lot of other questions asked as we're answering those questions. So I think what we'll try to do from the PAA standpoint is we'll download these questions and try and get some answers from the panelists, and then also provide those on our website as well, because they're filtering in as we answer the questions as well. I know I want to ask another couple questions, Andy, Caitlin. Some of the questions that came in had to do with the ventilation system. So should property owners, managers shut off ventilation systems in common areas as a precautionary measure? And are leasing offices considered common areas?
Let me answer the leasing one, and then I'll let Jill answer the HVAC one, because that's really where her expertise would be more suited. But I would say that your leasing areas would be closed to any outside. Like, I would think that you're leasing, that we're not, I don't know. I think a lot of our clients are closing their leasing offices. So once they close that leasing office, it's no longer a common area. But I would say that if people are going in and out of the lobby to get to their apartments, that would be like the only common area that would be open. And I would think that you'd want to close down just about every other area to the outside. Jill, are you on the line still? Could you answer the HVAC one?
Maybe we lost Jill.
Okay, we may have lost you. So my answer on that HVAC system is that I think it would be on a case-by-case basis, and there's definitely some controls you may want to put in place, especially if you have a ventilation system that's transporting air from your lobby into other parts of the building. So I think that if that's a concern, you would want to either talk to your HVAC contractor and really the industrial hygienist to develop a building-specific plan. But in general, the more outside air that you have coming into your building at this time, probably the better. So there's different things that you can do to try and lessen exposure. And there's so much that's not known about this virus that sometimes it makes sense to take some more precautionary measures at this time.
Okay, thank you so much. We have some questions for Paul and Ellen.
Hello, can you guys hear me now? I can't hear you.
Oh, we can hear you. We have some questions about a rotating schedule. What if an employee, you've placed an employee on a rotating schedule and they don't feel comfortable working at all, not even for emergency calls? How would you handle that?
So I think I talked about this already. Basically, from a legal standpoint, as the law is currently, that employee needs to show up for work. Can you force them to show up for work? Obviously not. Do you have the right to fire them? Currently, probably yes. Will the law change? Is the coronavirus, this emergency declaration, is the fear of their life a valid reason for them not to show up for work? Don't know how the courts are going to end up ruling on that. If you need to consider the health, safety, and welfare of your residents and what you need to do to protect them. So if you need that person to come in to work and they're not, and you have to go hire somebody else, then you need to hire somebody else to take care of the situation.
Thank you, Paul. One question that came out was if an eviction had started prior to all of this, and I know you did talk about the courts, and some questions were, are they open? And I know, you know, what courts come back online. But they were kind of asking, they believe that the tenant skipped, so should they still move forward? And they were awarded the judgment at this time.
Okay, so right now, basically all lockouts are being stopped. You can't do a lockout. And I know there was a question about whether the courts are open. So the courts are not open for the most part with regard to court hearings, and the ones that are will shortly be closed. But they are open and they are accepting the filings for right now. So you can still file the case. In theory, you could still file for that actual lockout. If the person skipped and they're gone, I would just go ahead and change the locks and take possession of the apartment. That's the practical answer, not the legal answer. Just a caveat, that's the practical answer, not the legal answer. But that's what I would
Can anybody hear me now? I'm trying to get on here. This is Jill.
Jill, we can hear you.
Okay, good. Because I'm going through instead of my phone, it's not coming through my phone.
So Jill, if you can circle back to the question about the ventilation systems on the properties, that would be great if you have any advice on that. Should they be closing ventilation systems, etc.?
Yes. It's advised because the information can go through the ventilation system. So if you know that there's a confirmed case, then you can block the ventilation system for the rest of the building. You can do that, but you would have to clean it. But it's highly suggested that you do close the ventilation system, or just bring in a lot of extra, outside air, because you don't want to have it go through, because there are some concerns that possibly it is airborne. So if you could do that. And as far as closing all the different areas, I agree, the laundry room should be available, because you'd much rather someone go to the laundry room than to go out to the laundromat, because then they spread the contamination in there. And then to go back to the earlier point that I was trying to get in there, I was having trouble getting my voice on here, was you definitely need a third-party industrial hygienist, because, and it was stated that you do need to do that, because you can't have someone policing themselves. Any other questions?
We did have another question come in. They want a little bit more clarification on how to handle someone who has an emergency that discloses that they do have COVID-19.
What do you, not quite sure what the question is.
Paul,
yes.
Paul, maybe this one's for you. They just want a little bit more clarification on how they should handle sending an employee into an emergency situation when the resident has COVID-19.
So I think that's more a question for Andy and company, because it's what they need to be doing to protect themselves when they go into that situation, and whether or not you need to hire an outside company to be able to go ahead and take care of that repair. So obviously the person needs to go in with protective gear as much as possible, and they should distance themselves from the tenant, whether the tenant goes into the bedroom and hides in the bedroom and is isolated from the person going into the property, which Andy's already talked about.
Okay, this is Jill. I'm going to step in. That's not going to work, because it's in the whole building. You would have to have people that are properly trained. So I don't know if there's any maintenance that are properly trained to do so. So I don't think that Andy's group is ready to train to fix, sewer overflows and so forth. So your emergency personnel cannot go into a place where there's a COVID problem unless they have it cleaned. So I'll let Andy answer the rest of that, but you cannot send somebody in, because unless you happen by some miracle have people that are fully trained in PPE, HAZCOM, and everything else.
Yeah, I mean, it becomes a very tricky situation, and I think you got to be extremely careful how you proceed. And I think the best course of action, I mean, listen, I mean, if you have a broken pipe and it's just pouring down water, I mean, you got to try and stop the flow of water however you can without accessing that space. If you do need to access that space on an emergency basis, you know, we could send people out, put on the PPE, and try and get in there and just get, you know, the water stopped, so to speak. But once, you know, you contain that initial flow of water, and hopefully you can do it remotely or whatever's going on in that space, right? I think the best course of action would be hire someone like Jill's firm, you know, bring in an industrial hygienist to come in, build a protocol for how you're going to treat that situation, because what you don't want to do is, you know, create a worse situation in the long run in order to either save a couple of dollars or to, you know, affect, you know, or to, you know, speed up the process. You know, maybe it might take a little bit longer for us to get there and solve the issue, but in the meantime, you're not putting your own staff at risk, or, you know, I know Jill and I are definitely not going to put our staff at risk in order to like unclog a toilet. So there are some, you know, if you do have a COVID case and it's just a clogged toilet and all we have to do is go in there with a plunger, that might be something that we could possibly send a crew out to go put on the PPE and do that work. But I don't think I would be really comfortable recommending to any of my clients to bring an untrained person into that environment.
Right. Absolutely. A health specialist, I totally agree with him.
Okay, so we're getting to the end of our call. We've got 15 minutes left. If there's any other questions that any of our attendees want to present to us, we'll do that now. We'll try and answer as many as possible, but I think we have a good question here. What if a resident refuses to allow maintenance into their apartments, even if it is a reported maintenance emergency?
I would say that that's the tenants, if they're not going to let somebody in, they have to deal with whatever the problem is. You know, they just have to understand that. I mean, that's you know, if I don't want anybody coming into my place, I'm not going to ask them to come in. So that's not something we have to worry about that.
I think the emergency maintenance could be, you know, hot water tank that's exploded, you know, 2 floors above them and maybe leaking down 2 floors below. So it may not even have to do with that particular resident. I mean, I know that even in non-critical times, there are some residents that do not allow admittance into the apartment. So what advice would you have for the property managers at this time?
Well, like I said,
listen, I could answer from my standpoint is that because like this is like for me that's Tuesday, right? You know, we do 11 calls a day. So from our standpoint, you know, this is just that same situation, but it's just a lot trickier. And then at that point, I think you just have to rely on, you know, it's going to be a case by case basis. And I think that you contact someone like Paul and, you know, and you work your way through it. I mean, it becomes, when we are denied access into a unit that needs service, then it's just as a process of one step at a time. I don't think there's like a blanket statement I can say, here's how you're going to solve this issue, because it's probably a specific issue that needs to be addressed.
Yeah,
But
and the question is how big of an emergency is it? How quickly do you have to get in there? Is it something that has to be done immediately? Is it something that gets worse every minute? Is it something that can wait a little while? So you're really going to, like Angie said, have to deal with it on a case-by-case basis. And always considering what's in the best interests of your other residents and your employees.
absolutely.
Perfect. I have some updates. So while we've been on the call, Lancaster area has a confirmed case and Allegheny County is now up to 12. So that was just in our call today. I think what we'll do is, if there's no other questions at this time, we're going to lump some questions together and put some answers on our website. We'll probably do that late this afternoon, early tomorrow, just so we can update you all. I want to thank all of our panelists today. This has been very informative. And if our attendees have any questions, you can always send them to info@paahq.com. we're going to put up on our screen now. We want you to continue the conversation. At this point, we are our best resources. We exchange ideas. We have to ask questions. We have to learn how to talk with one another in this fast-changing environment. PAA has set up a coronavirus in your apartment community open forum on LinkedIn. And this is a place where you can go and ask questions of other property managers, management companies, about what they're doing on their properties. We also have a closed group for our owners that will be sending out today as well. As always, we have the coronavirus and your apartment community updates on our website as well. Again, any questions, it comes to info@paahq.com. Before we end our call today, I just want to ask the panelists if they have anything to add before ending our call, and we will get all the information out to you from PAA. Anything to add? Well, thank you, and have a good day. Stay safe and healthy.